Hello, boys and girls, and those who like to bounce in between. It's Comrade Danky here with another Tennessee news update. But alas, ladies and gentlemen, this is my last free article from Tennessean. I don't know why these guys want us to pay to read their articles because it's you'd think they would just find a way. But ladies and gentlemen, we have a article here by Brian Kelman of the Nashville Tennessean called "Feds Will Cut Off Rural Tennessee Hospital That Is Too Broke to Keep the Lights On." This was published on May 29th, 2019, so almost a month ago. Federal authorities announced Wednesday that they are ending Medicare and Medicaid payments to a rural Tennessee hospital that has become so woefully broke that it cannot pay its employees, its vendors, or even keep the lights on. Wow, that sucks. Portions of the hospital lost power last month because a $33,000 electricity bill had not been paid. Federal officials also allege the hospital has withheld taxes from employees' paychecks but then kept the money instead of paying it to the government. Jamestown Regional Medical Center, an 85-bed facility that is the only hospital in Fentress County. Wow, it's the only hospital in a whole county. It will be terminated from government reimbursement programs on June 12th, according to an announcement from the Centers of Medicaid and Medicare Services. Reimbursement is a major funding for any hospital, so termination is likely a death knell for a hospital that was already in a desperate situation. Earlier this month, the Tennessean reported the hospital had reported net losses of more than $4.7 million over the past 3 years and identified the hospital as one of the 15 most struggling facilities in the state. In the weeks that followed, WBIR News in Knoxville reported that the hospital was low on supplies and was no longer admitting ambulance patients. The for-profit medical care system in this country is a fucking failure, ladies and gents. This graph here says at least 10 rural hospitals have closed since 2012. But a new federal investigation report released Wednesday showed that finances were even worse behind the scenes. According to a report, Jamestown Regional Medical Center owed more than $4 million to more than 200 vendors as of earlier this month. In addition to the unpaid electric bill, the hospital owes hundreds of thousands of dollars to emergency room doctors, a clinical services company, and even its own billing vendor. Wow. The hospital was also making weekly payments to a blood bank to pay off a $15,000 debt. At least one doctor recently quit the hospital because he felt the lack of staff, supplies, and equipment were unsafe, the report states. The investigation report also states that at least 5 employees told investigators that they had discovered that income taxes or Social Security funds were withheld from their paychecks but never deposited with the government. One employee said her Social Security payments had not been made in 3 years. Calls to the hospital administration were not immediately returned. The calls at this hospital are just the latest and worsening crisis in Tennessee's rural hospitals. As health care has become more expensive and health insurance lags, many rural hospitals have been unable to pay their bills, creating healthcare deserts in poor, far-flung towns where residents are often the most vulnerable. 10 rural hospitals have closed in recent years, and at least 15 more hospitals, mostly small and rural, have lost more money 3 years in a row. So this is a pretty sorry situation. We're having hospitals in rural Tennessee closing down. Like it says, this is the only hospital in Fentress County. So what are all the people in Fentress County supposed to do if they have an emergency? Where the fuck are they going to go? Uh, how, they have to go to the next county over? That's bullshit. This is why our for-profit medical system is failing. It's failing here in Tennessee and it's failing everywhere in this country. And these insurance companies have made way more than enough money off of all of our suffering. And so they need to go fuck themselves. Business has had its day in the sun. And, we need publicly funded medical care facilities that will be insured to be operable and won't run into so much debt that they have to close their doors, especially if it's the only one in the county. That's absolutely disgraceful. The people of Fentress County deserve access to a hospital. This is so absurd that I have to say this. It's the year 2019. But then keep in mind the people of Flint, Michigan also don't have clean drinking water. So we have whole swaths of areas in this country, whole communities that go completely ignored and go without the very basic necessities that have been available to modern civilization for decades now. Internet, hospitals, clean drinking water. The list goes on, folks. And we've seen the private market, the trickle down economics, neoliberal economics, all of that shit has done absolutely nothing to remedy it. So be sure to like, comment, subscribe, follow me on Pornhub. That's Comrade Danky hot take on Tennessee's shitty healthcare system.